Thank you, Ms. Wasserman-Schultz. Ms. Dexter.
Thank you, Chair Fox, Ranking Member McGovern, and members of the committee. I appreciate this opportunity to speak. I did not spend 20 years taking care of the sickest patients in our community to come to Congress and let their healthcare system be decimated. I came here to fight for my constituents, the people behind every statistic and policy debate, who just want to be able to see a doctor that they can trust, afford their prescriptions, and keep their families healthy and safe. Letting the Affordable Care Act tax credits expire this year means Republicans in this chamber are complicit in forcing tens of thousands of Oregonians I represent to make impossible, deeply offensive choices. One constituent wrote to tell me, quote, "I just got notice that my marketplace plan is going up from $568 a month to $1,221 a month next year, an increase of $7,836 a year." Another, a 62-year-old living in Portland, wrote, quote, "I received an email from my plan saying my rate without ACA support will go from $139 a month to $1,083 a month starting December 31st. That's an 8-fold increase, and it equals $11,328 per year. Families and seniors in my community cannot afford price hikes like this. They will be forced to make impossible choices between keeping their health insurance and putting food on the table or paying their rent. And as a doctor, I can tell you what will happen. People will go without. They will go uninsured. They will delay care. They will skip medications. They will get much sicker and potentially be financially ruined as a result. That's not speculation. It's what I saw in practice for 2 decades. People suffer in silence until it's too late. And then we all, taxpayers and community members, pay the price. And even in instances when a patient doesn't get sicker, putting insurance out of reach has consequences. When we make healthcare unaffordable, healthy people drop out. They leave behind the sickest. That raises premiums, and we end up in a vicious cycle of rising costs that hurt every American looking to access care. I know firsthand the consequences of inaction, so I'm proud to join my colleagues in introducing an amendment to extend the ACA premium tax credits to ensure health coverage is not put out of reach for more than 111,000 Oregonians who rely on this critical support. And if Republicans' refusal to extend the ACA premium tax credits wasn't bad enough, my community is still reeling from the devastating impacts of Medicaid cuts and trying to understand what they're going to mean in the big, ugly betrayal bill. In the wake of its passage, I heard from a single mother in Parkdale who said, quote, "The cost of everything is still rising, and if I lose my benefits, I won't be able to afford my rent, food, or clothes for my children and myself. When I am home in my district talking to Oregonians, this is what I'm hearing time and time again. The cost of living is too damn high. People are doing everything right, working hard, playing by the rules. They're raising kids, starting businesses, going to school, paying taxes, struggling paycheck to paycheck just to get by. And they are still just one bad policy decision from losing it all. I refuse to accept this as our destiny. I choose to believe in the ability of this institution to do better by the people it serves. I implore my colleagues on the other side of the aisle to show courage and not leave behind the working families who are desperate for relief. This is a moment for moral clarity. Do the right thing. First, extend the ACA tax credits. We can and must fix the system, and we cannot abandon our constituents today while we talk about how to make it better. Number 2, repeal the harmful provisions of H.R. 1. Commit to giving every family in this country a real chance at achieving the American dream. And before I close, I wanted to thank Congresswoman Wasserman-Schultz for her leadership in advancing a critical amendment to restore the $51.7 billion in advance funding for the Toxic Exposures Fund that has been stripped out of this package. For over 7 years, I was honored to care for veterans at the Denver VA, where I walked past a sign each morning that read, "The price of freedom is visible here." As a pulmonologist, I was often the specialist trying to address the breathing challenges of my patients exposed to burn pits, Agent Orange, and other toxins. It is unconscionable to me that today, of all days, Democrats have to fight to ensure our veterans, poisoned on the front lines get the benefits and care they deserve. We must ensure all Americans, including and especially our veterans, get the care they need, not just to survive, but to actually thrive. Thank you, Madam Chair. I yield back.
Thank you, Ms. Randall.
Thank you, Madam Chair, for the opportunity to testify on this funding package sent to us from the Senate. I'm glad to be here today, testifying in committee after the Speaker canceled votes and has kept us out of